Gynecologic oncology is composed of multiple different cancers. Cancer of the vulva, the cervix, ovaries, fallopian tubes, uterus. Each one's treated specifically based on their cell type. What we do with GYN oncology is we have surgeons involved, which is myself, and we also use chemotherapy and radiation depending on the stage of the cancer. The nice thing about it is that we're able to treat the patient, see the patient, and have all the doctors in the same roof. It actually helps. It's shown its help in outcomes. It definitely helps in outcomes. It helps in getting treatment established and started. And the outcomes that we have here will rival anybody in the United States. So most common GYN cancer in the United States is endometrial cancer. And again, that's one that the robot is really just absolutely perfect for. What it'll take is a patient that comes in and has the most common cancer, one they're able to be treated and cured most often with surgery alone and don't have to go through the complications of an open surgery. So in Arkansas, there's approximately 115 ovarian cancers a year. At Highlands, we treat probably 50. We have a research department that helps patients with ovarian cancer have an opportunity to have the latest and greatest drugs that aren't available to the general public yet. And if they qualify, we're able to offer that treatment to those patients. The younger ladies sometimes will have precancer conditions. It can be an ovarian mass. It can be irregular bleeding. It needs to be worked up fully, to make sure that you don't have any complicating factors or you don't have a diagnosis of cancer. One of the most common problems in younger women is irregular bleeding. And in that, you have a spectrum of development of GYN cancer, most notably endometrial cancer. Endometrial cancer will start with irregularities and then eventually develop into cancer. But if you catch it along the way, you're able to cure that without developing a cancer. What we do is we use a robot, and I use sentinel lymph nodes. And sentinel lymph nodes are just the very first lymph node, the most important lymph node is called the sentinel. And we're the only one in Arkansas that actually does sentinel lymph nodes. It allows us to do more complex surgeries safer with less complications. We use it for endometrial cancers, pre-endometrial cancers, cervical cancers. It's absolutely essential in my practice that we have the access to do sentinel lymph nodes. So a lot of times in GYN oncology, you don't actually have the diagnosis of cancer when you come in. You'll have a postmenopausal female with bleeding, or you have a postmenopausal female with an ovarian mass or an elevated tumor marker. That all can be still worked up, minimally invasive, whether it's laparoscopic or robotic. You just have to have a surgeon that has the ability to do that. The outcomes are going to be the same. There's no reason to have pain and suffering through an open incision when you can do it minimally invasive.